Hello and welcome to EMR Optimization for Cancer Screening, Accuro EMR. This video is training module number 5 and the topic is cancer screening workflows. Please take a moment to review our speaker disclosure slide. The objectives of this training video are to help Accuro users understand the main components of a cancer screening workflow and learn how to apply EMR functionality to a workflow. So what do we mean by a cancer screening workflow? Well, in this case, we define it as an organized, coordinated, ongoing series of activities designed to effectively manage the screening needs of your patients. To say that in more simple language, we know that cancer screening involves numerous steps, each of which may occur at any point during the workday and may be performed by one or more members of the practice team. These include actions like ordering a screening test, identifying patients due for screening, and receiving a test result from the lab. Workflows allow us to think about how each step fits into an overall process, and by taking this view, we can think about how each step can be performed optimally for better effectiveness. The previous training modules have described EMR functionality that can be used at various stages of a cancer screening workflow. By now you should be familiar with this simple cancer screening workflow diagram. We discussed the two main components in our training modules on searches and tasks. Population-based screening refers to activities undertaken by the practice to proactively identify all patients due for screening and connect with them through some type of organized outreach. By using cancer screening searches or running a task report, practices can identify those patients with their EMR. In the case of opportunistic screening, EMR tasks are set up in a patient's task module. EMR tasks act as prompts for clinicians to talk to their patients about getting a screening test done. When the test results come in, the task can be updated as complete and a new task can be set for the next screening test, and the cycle continues. If both of these components of the workflow are being performed optimally, a practice can maximize their cancer screening performance. It's therefore very important that each person on the team who plays a part in the workflow understands his or her role in the process and ensures steps can be followed seamlessly. With that in mind, we have compiled a list of considerations that should be documented in every step in a team's cancer screening workflow. For opportunistic screening, these considerations include how test results are received and who enters the results into the EMR. How does the clinician use the task module as a prompt to discuss screening with their patients? How is this discussion logged in the patient records? For population-based screening, some considerations include what EMR functionality will be used to identify patients due for screening? Who generates the list and how frequently throughout the year? How and when will a clinician review the list? What methods will the team use to contact patients? And how will you know that this effort was successful? Cancer Care Ontario has developed 2 worksheets to help you document and improve your cancer screening workflow. These tools provide you with the basic steps in a cancer screening workflow and a list of questions to consider at each step. When the activity will be performed, who will perform the activity, and how can the EMR assist you? The worksheets will also encourage your team to identify areas in which your workflow could be improved and suggest potential changes that can make your workflow more efficient. Because a workflow may include all members of your team, we encourage you to go through this exercise as a group. The workflow works best when everyone understands their role in the process and how all the pieces fit together. And that brings us to the end of training module number 5. Additional resources are available for this module. As I mentioned, we encourage your team to complete the worksheets on creating and improving your cancer screening workflow. Please take a moment to complete the short quiz that will test what you've learned in this module. If you've been watching these training modules in order, you have now completed the Accuro EMR optimization training. Please be sure to complete the evaluation surveys to give us some feedback on your experiences with the training. Thank you very much for watching.